Assalamu alaikum and welcome to the first episode of our brand new show, Mental Health Matters, with me, your host, Maryam, Hilli. And joining me on this weekly show is our very own mental health professional, Sister Anisa Diab, who's got over 10 years of experience in the field with both degrees in psychology and counselling. She's helped people all around the world with their personal development through her online practice. Some of the concerns that she addresses include anxiety, depression, mental health, spirituality and identity, anger management, relationships, parenting and family, and so much more. Welcome to the show, Sister Anisa.
Thank you so much. Wa alaikum assalam.
Thank you so much for joining us, Sister Anisa. Hopefully during this weekly show, we'll be able to gain some insight from your mental health expertise on different psychological strategies and spiritual tools that we can apply to our daily lives, which will help strengthen our mental health, inshallah. From time to time, we'll also be having some guests on the show that can weigh in on a variety of topics, ranging from issues such as managing anxiety and depression and how to look for a spouse or deal with the aftermath of a divorce. My first question to you, Sister Anisa, is can you tell us in practical terms why mental health matters and what this means to our listeners?
Absolutely. Assalamu alaikum, Sister Maryam, and to all of our viewers tuning in. So, mental health affects everyone. As long as you have a brain, as long as you can think, you can feel, mental health doesn't just matter. It's really everything. So you can be a very successful person in life academically and financially, but if you don't know how to manage your emotions or practice conflict resolution or even just handle basic stressors in life, you really can't be a fruitful, productive person in society. So when we discuss counseling and mental health and getting professional support for these issues, a lot of times people feel like, well, this isn't for me because I don't have anything wrong with myself. This is for people who are struggling with anxiety or depression, or they're struggling with some sort of mental illness. And I think some people are just so quick to change the channel and say, like, wait, I don't really need to hear about all of this. But I think as the saying goes, you can't learn what you think you already know. So I hope viewers, inshallah, will make a space for making mental health matter in their lives, and not just in watching the show, inshallah, but in really practicing the tools that hopefully we can provide to our viewers. We all have mental health, and I really believe our mental health is an amana. It's a trust from Allah that we need to take care of. And I know from experience working with my clients, having mental health related concerns can severely affect our relationship with Allah if they're not dealt with properly. So mental health is one of those things that if you don't keep it safe, you don't protect it, you don't use it wisely, you can lose your mental health. So I'm really looking forward to all these segments that we're going to do together, inshallah, and the discussions on this weekly show.
Inshallah. And so in today's episode, we're kind of trying to inform our viewers about what mental health is, just for them to be able to identify exactly what it is, and so that they can know what stigmas are related to mental health and just be able to recognize if they are kind of going through a mental health issue themselves. So what constitutes as mental health?
So mental health is kind of a very broad term, and what the best definition that I've seen is from the World Health Organization that defines it as a state of well-being in which an individual can realize their own potential, can cope with normal stresses of life. A person can work productively, fruitfully. They're basically able to function in such a way where they are making a contribution to their community. That's when somebody's in a state of mental wellness. However, mental health, I want our viewers to visualize mental health on a spectrum. So on the one end of the spectrum, you have mental wellness. And then on the other end of the spectrum, you have mental illness. And then right in the middle of that spectrum is mental distress. So I'm going to use the example of a college student. For many college students, that's a stressful time, right? There's so many deadlines every week, exams, reports, all that's due. And most people will report some level of stress around time management or feeling prepared for exams and studying, but they'll go from feeling mentally well to distress, and then, be able to bounce back to that place of, okay, I can still function, I can still, relax and have a social life and go on with my day. Whereas somebody who struggles, for example, with anxiety or depression, who is also a college student, may actually, have a completely different experience, right? Because they're more on the mental illness level of the spectrum. So, they are going to maybe have a panic attack, possibly in regard to an upcoming exam, and that might prevent them from studying or being able to bounce back as easily, in terms of feeling mentally well. And maybe for them, mental wellness looks like they were able to study and get along through the week without having any kind of anxiety attack or, hyperventilating before the exam. So I think that we've got to recognize mental wellness looks different for everyone. It depends on their overall context, and everyone has a different experience, but we all struggle with mental health at some point or another. I think we can all relate to feeling like we have been in so much distress that it might have been difficult to function for the day, and recognizing you need a mental health day, right? So we all, when we look at the research, it shows that about 1 in 4 people will struggle with a mental health disorder. And so that's about 20% of people we come across in our daily life. So most likely there's a friend that we know of who's struggling, or a family member that we know of, and possibly somebody we work with who we don't know what they're truly struggling with behind the scenes. And I think that's why it's so important to be kind and understanding, because you don't really know what somebody is struggling with. Something that might be very simple for yourself might be just very challenging for somebody else. So what's interesting is most people will tend to exhibit some kind of mental health disorder about the age of 24 is when that would begin to manifest, at least 75% of people. And mental health is one of those things that it's not the result of like one event when it comes to having a mental health condition, that is. So like research shows that like it's multiple factors. It could be genetics that impacts whether somebody will develop a mental illness at some point in their lifetime. Maybe bipolar disorder runs in their family. It could be a stressful life event that happens. So what I think about a lot of times, example with women is having children, giving birth. Sometimes that they can develop postpartum depression after that. Or it could be, lifestyle choices. Maybe somebody has decided to experiment with drugs at some point. So for instance, marijuana, and then, suddenly they find themselves a few years later dealing with schizophrenia down the road, which, a lot of times people just experiment with certain things, not realizing that it can cause other disorders to manifest down the road. So there's so many different aspects, and sometimes it's a culmination of all those things. But, the main takeaway is none of us are immune to developing a mental illness. And that's why it's so important for us to be informed so that we can protect our minds, inshallah.
Inshallah. And you said that mental health looks different for everyone. So how does one recognize that they're suffering from a mental health issue, or if they're just going through, a down period in their life, or they're just feeling a bit blue?
Yeah, so normally when it's a mental health issue, on the level of being what's considered a disorder, we're talking about an impact in the ability to function. Functioning and relationships, that's the major thing. So for instance, somebody, normally they love to, go to the masjid every week. And they know that about themselves, that I love to socialize, I love to be a part of that scene. And then they notice any kind of significant change in their mood. And you would want this change would have to be for a prolonged period of time where, it would be like, for instance, with depression, that person would be tearful more days than not, sad more days than not. You'd be looking at things like, has this person lost pleasure in things that they normally enjoy doing? You would look at other criteria like sleep, is there oversleeping, undersleeping, overeating, not eating enough? Is there irritability? Definitely suicidal thoughts, things like like that are red flags that, hey, maybe this is not just regular distress. There's something more here that's going on. And I think it's always a great idea to reach out to a mental health professional. Something doesn't have to be wrong with you in order to do that. But these, mental health professionals are trained, all right? They have criteria that they use to screen individuals to give them a proper diagnosis if there is something going on. Unfortunately, as you probably know, Sister Maryam, a lot of people just will, Google their symptoms online and try to diagnose themselves or diagnose their friends. And I really don't recommend that, because you can get a lot of misinformation on the internet. I think it's a great tool that we have such easy access to information at the tips of our fingertips, but we also, just like you would be struggling with a physical issue, you'd want to go to a doctor to deal with that. So I think it's really important to make sure that you're reaching out to the right folks to get that help. And inshallah, we can talk more about what those folks look like and what their credentials and backgrounds would need to be to get that assistance.
Okay, and I kind of want to talk about the Muslim community a little bit, because I know that a lot of people draw a comparison between lack of faith or having little faith, for example, and mental health. So whenever somebody is perhaps going through a mental health condition, people might respond to them by saying, oh, just have a bit of faith, or, your iman is too weak, or those kind of phrases. So I wanted to kind of ask, what are the most common mental health conditions that are faced by the Muslim community, just so that people can recognize that this is something that does exist within the Muslim community?
Absolutely. I think that is such a common, response, unfortunately. And the thing is, that creates more shame, that creates more stigma in terms of getting help, which we'll talk more about, inshallah. But, first of all, I think we need to recognize that, the Muslim community is one of the most culturally diverse communities in the world, right? And so when it comes to what the most common mental health conditions are faced by the Muslim community, obviously you'd have to look at things like, the culture, the ethnic background, the politics of the area, and etc. But, when we're looking at the most common sorts of issues, things that come to mind, at least especially with the Muslims I work with, are anxiety and depression. I would say those are the top two issues. And again, we're not talking about just feeling sad for one day or feeling stressed out for one day. We're talking about a chronic issue where sometimes there's no rhyme or reason to feel sad or anxious about something, but this is the person's default behavior, right? Other things that I see a lot with the Muslim community are issues related to identity, especially like if you're living in the West, dealing with Islamophobia, dealing with generational gaps between parents and their way of being raised and adopting certain cultural values, and then the child's way of being able to adopt certain values in their context and in their culture that they're living in. Relationship issues come up a lot, so there can be some adjustment issues just from dealing with divorce in the community, dealing with the loss of a spouse. Those are some things that come up. But also I see a lot of obsessive compulsive behaviors. Sometimes this coincides with religion as well, where somebody feels like they're not praying properly, they're not doing their wudu correctly. So it can really impact somebody's worship as well. And that's something, inshallah, maybe we can do in another episode to talk about. But there's also personality disorders that we see, mood disorders. The most, like I said, are anxiety and depression. And, there hasn't been, I will say, like a whole lot of research, especially in the West, except just in the past decade or two, it's begun to start looking at specifically the Muslim community and the most common issues that they're facing. But they've done some studies. For example, there was one based out in Chicago that looked at about 700 Muslim clients and the types of issues they deal with. And so at the top of the list was adjustment issues, anxiety disorders, and then mood disorders, OCD, post-traumatic stress disorder is another big one. So that, and a lot of times, dealing with refugee communities in particular, coming from war-torn areas, There's a lot of PTSD among that population, nightmares at night, hypervigilance, constantly feeling on edge, like something bad is going to happen to them. And so this is real. I mean, this is really happening in our community. None of us are immune to it just because we're people of faith. And we need to recognize that, there's emotional health and there's mental well-being and there's spiritual well-being, and these facets of our life, they're different, and we want to be able to mesh them all together in a way where we're healthy, right? And that's on an emotional level, a spiritual level, a physical level. A lot of times people think, well, mental health is just about what's in your brain, but it really does affect everything. It affects your body, it affects your faith. And so we want to be able to resolve all those different aspects of our life so that we can function and we can have a meaningful relationship with Allah subhanahu wa ta'ala.
Thank you. A lot of what you said actually, it makes a lot of sense, because I know that particularly because I'm from the Iraqi community, and a lot of Iraqis had to migrate because of the situation in Iraq at the time, like talking about the 80s here and stuff. And a lot of them did suffer from PTSD, but they probably don't even recognize it. It's only in recent years that I think people have begun to recognize some of the symptoms that they have for certain conditions like PTSD, as you mentioned. But I want to you briefly mentioned stigma in the Muslim community. So I kind of want to expand a little bit on that and ask you, what does mental health stigma look like in the Muslim community?
Sure. So let's start by defining what stigma is. So, it's interesting, in archaic times, stigma was used to signify a scar that was left behind by a hot iron. And today we use this term stigma to really discuss those who have been branded with shame and disgrace due to certain circumstances or characteristics that they might possess. And I think there's no doubt that as Muslims, many of us recognize what it feels like to be stigmatized, right? Especially due to our religion and our beliefs. But I think, when it comes to mental health, it's much more of a struggle. Because when we're stigmatized for wearing hijab or our faith, at least we have inbuilt social supports in place. When we go to the masjid and we hear our, scholar on the minbar talking about, the challenges of Islamophobia, and we're able to feel united with our brothers and sisters in the room who are facing the same, it's dealing with something external that's you're all kind of dealing with together, and it's not as the result of something that is happening with you internally. It's an external oppression coming in. But when it comes to mental health issues, the stigma is a little bit different, because let's face it, you're dealing with something that you can't help. That's not a choice, right? Nobody asked to wake up one day and want to have bipolar disorder, for example. Nobody wants that. And if they could just snap out of it, they would. But the challenge is, where does that person go to for support? What inbuilt supports are in place? And then there's a fear of, well, if I do open up to somebody else about the fact that I'm struggling with this, am I going to be judged? Am I going to be shamed? There's so much fear from that, because we know that shame, it creates silence, and that silence creates more stigma. So it's this never-ending vicious cycle. And when we look, I was just looking at, the worldwide trends when it comes to the barriers around mental health for Muslims around the world. And it was talking about how, hands down, wherever you go, stigma is the number one barrier to getting mental health support. So they looked at studies, for example, of people in Muslim families in Nigeria, and they found that number one cause was stigma. They looked at women in other parts of the world, such as in the United States and Australia. There were fears of, is somebody going to find out that I'm struggling with this? How will this affect my ability to get married, to have a family? How will it affect my academics, my ability to find a job, if I just even open up and talk about these sorts of issues? So it's really significant when people feel like, they know they're struggling, they know they need help, but they're so scared to get it because of how it's going to be received by other people in the community.
With a lot more people talking about mental health in the community, do you feel that it is still a topic that we should discussing stigma around mental health or not?
Absolutely. I think that it's been so promising to see that more and more people are talking about it. And, I think mental health is everyone's business. Everyone needs to educate themselves and create more awareness. When I started speaking about these issues over a decade ago, it wasn't, something that was talked about enough. And now it's been really wonderful to see it gaining traction in the community. And I had a conversation actually with someone the other day who was planning a conference, and he was saying to me, I'm really tired of these talks on stigma, and I just don't think we even need to have them anymore. We need to be getting into deeper issues like talking about addictions and things like that. And listen, I would love nothing more than for us to be able to delve into deeper issues, and we are doing that as a community. But I think it's critical to have everyone on board together, because the fact of the matter is, while some of us have more awareness on this and we're ready to move forward, there's still people that aren't there yet. And so we need everybody on this boat in order to move forward, inshallah.
Inshallah. And so what are the challenges that you think are still present that need to be addressed?
So there's so many faith-based misconceptions about getting mental health treatment in the Muslim community. So I think these barriers really need to be addressed. Issues, for example, of believing that if I reach out to a mental health counselor, that it's shaming my family. I should be able to I should keep my issues, concerns just within my family and not air my dirty laundry. But we've got to recognize that counselors are bound by ethical, stipulations. They cannot reveal, personal information you share in this session. And so, your information is going to be kept confidential. This idea that you mentioned earlier, Sister Maryam, about, just reaching out to a mental health professional being a weakness of faith, of iman. I've heard, unfortunately, some scholars even saying, like, don't go to a mental health professional because they're going to take you away from Allah.
Yeah.
They're going to, brainwash you with their ideology.
Yeah.
And this is most unfortunate that I see this happening, because that's a major deterrent. I mean, I understand people wanting to find a counselor who is going to respect their faith and their values, and counselors have to do that ethically anyway. But if that is the case, find someone you're comfortable with. Find a Muslim mental health professional. There's so many out there. So I think these challenges still really need to be addressed, especially because we need to get to a point where we're, addressing this on a systemic level, where, we know people that, are of minority populations have more of a challenge with getting mental health support. So we need to be advocating for policies that, are getting giving everyone a fair chance to be able to receive the services that they need when they're struggling with their mental health related issues. And we can't do that, right, if we're still dealing with these sorts of problems of believing everything is going to go away with dua. I mean, yeah, dua is important. It's a huge coping strategy, and it can work miracles. But just like the analogy goes, you don't, pray away your broken leg. You go to seek professional support to make sure it heals.
Yeah, definitely. I totally agree with you. So for those who do kind of like have this mentality that their faith can guide them through whatever it is they're struggling with, how do you convince them? I know you said that counsellors kind of obliged to keep things confidential, but aside from that, what other things can we say to somebody who is reluctant to seek counselling?
So I think, I was one of those people, as an adolescent, I had this belief system that, okay, like, I have Allah, I really don't need anything else. Like, I'm getting through my issues just fine. And I think there are some people, just maybe they are at a point where they're not ready to take that next step. And I think that if that's working out for them, then that's okay. There's no denying that Islam has given us everything that we need to get through this dunya. But my question is, do you want to just get through what you're going through, or do you want to grow through what you're going through? And I think that's where talking to a mental health professional can be so helpful, because it's somebody on the other side who's committed to your personal growth. They don't want to see you just surviving through life. They want to see you thriving through life. And, I think how many times, Maryam, I'm sure you've seen this, sister, where we open up to our friends about something that's bothering us, and we receive a response that is so, it can be honestly destructive and really make us feel like we're in a worse place coming out of that. It can even cause more distress when we share things with friends or family members, especially if they don't keep your information confidential. And you just don't have that with a mental health professional, right? They're going to keep what you say in the room. And I think that we can all benefit from enhancing our emotional intelligence in life. So everyone, I think that's okay if somebody doesn't want that support at that point in their life. But I think like one of the biggest ways to break stigma is to say to somebody, hey, like I actually received counseling services before and it really helped me. And I can recommend somebody to you. That's, I think, one of the biggest ways I've seen people feel more open to getting help is when another person says, hey, I've done it. And it was, I really recommend that you see so-and-so because it helped me make the following changes.
And on the kind of the topic of a mental health professional, how can you tell that somebody is qualified enough? And for a lot of people, they probably won't be able to differentiate between the term, like, a psychiatrist or a psychologist. Can you kind of tell us what the difference is between them and how to seek the correct mental health professional consultant?
Absolutely. So you want somebody with the proper credentials. So this should be somebody with a postgraduate degree in some psychology related fields, such as counseling, psychiatry, social work. These are individuals who've gone through rigorous training, right? Like over 1,000 hours of clinical internship and training with the client population they're interested in. And then after that, they have to complete examinations, and that looks different in every country. But there's licensure, there's certifications that are in place in order to make sure that these professionals are meeting all of the ethical boundaries and exercising their due diligence with their clients. So, just to give you a little overview of the basic differences, if you go to see somebody who is a psychotherapist, a mental health counselor, that's going to be somebody who's going to do a lot of talk therapy with you. That's going to be somebody who's going to sit down and really address one by one your issues each week, help you develop coping strategies. Depending on their background, they can even help with diagnosing if you feel like you're struggling with some sort of mental health issue, but you're not sure what it is. If you go to see a psychiatrist, that's somebody who specifically can prescribe medication. That's somebody you want to go to, especially if you need some sort of medicine for treatment. If you want to see somebody at your, if you're a college student, if you're somebody who's a student, there are people as well at your college campus, at your school, who can help you with your mental health issues as well. So a lot of times people think guidance counselors are just there to help schedule students, but in a high school setting, they're also there to help with mental health related issues too. College campuses are I worked for many years on the college campus providing counseling to students, and it's a great time, I think, especially like we spoke about earlier, knowing that mental health issues tend to manifest between 18 and 24. That is a really great time to reach out and get some mental health support. So those are just a little bit of the differences. But again, you want to make sure that you're doing your research when you are reaching out to somebody to set up that first appointment, inshallah.
I wanted to ask you, Anisa, what are the ways of recognizing that somebody you are close to, someone that's dear to you, how can you recognize that they're going through a mental health issue, or how can they recognize that they're also going through a mental health issue?
So that's a great question. And there are a lot of signs that people will give. And, there's a saying that people don't hold up help signs. Usually they hold up masks. And it's important for us to be able to look at body language, look at someone's mood and behavior, and we all have this fitrah, this gut instinct when something is off about ourselves or with somebody else, right? And I think it's really important to recognize what some of those things are. And I think the biggest way to break the stigma around mental health is to educate yourself about those warning signs. So if you see somebody that just doesn't seem themselves anymore, like, just usually is pretty happy and upbeat, and all of a sudden you notice they're more withdrawn. I think that can be a big sign, because depression can mute a person's ability to reach out. If you see somebody who's maybe, I remember talking to a parent one time, and, unfortunately, this child ended up ending his life by suicide. But she said, I wish I had looked at one of these warning signs before, that she noticed her son was sleeping like ridiculous amount of hours. And she thought, oh, this is just being a teenager and he needs more sleep. But that was a sign of depression. And so it's really important to just educate ourselves. And if you go, for example, on the World Health Organization website, there's a tab on there with regard to mental health. And I recommend you look through that and just get an understanding of what some of those signs are. I think the main thing is we all have the ability to intervene and be a first responder in getting somebody the help that they need. You don't have to be a psychiatrist or a counselor to help somebody, get professional support. It's a lot of times, just everyday people who are the ones that are the liaison to getting those individuals the professional help that they need. But people want to feel like you care and you notice that something is off. And when you recognize it, there's a lot of relief for the person who may be struggling, that, wow, somebody cares, somebody recognized that something is off about me, and they will appreciate that.
Okay, and for some people who are suffering from a more long-term condition or from a severe mental health condition, is there any hope for them?
Yes, absolutely. And especially because now with early intervention and, individualized education plans and advances in medication, we're seeing people who traditionally wouldn't be able to work or go to school, attend university, they're able to now. And it's thanks to these interventions. So the key is to get the help and get connected to that support with, they've done studies, for example, with certain mental health issues like depression, and found that people who do get cognitive behavioral therapy and or medication, and 85 to 95% of the cases are able to overcome their issues and report improvement in their symptoms that they were struggling with. So we have the science behind this, that it does help. This does work, inshallah. It's just about breaking the stigma so that individuals can get the help and support they need.
So aside from getting the help and support that they probably need, can they then go on to become successful in their life?
Definitely. I mean, I can tell you, one person in my life she was so influential to me growing up. She was one of the people that helped me develop a love for Islam, a love for Allah. And she struggled with, dissociative identity disorder and, what was previously called multiple personality disorder. And she, to me, was one of the instrumental people, and like I said, bringing me to Islam, but also inspiring me to be who I am today. And she went through some real struggles, but we've got to recognize that people, success looks different for everyone. And there are some people that when I was working in a college setting, I'd see these students coming in with suicidal ideation and relationship issues at home with parents. And subhanAllah, at the end, they find a way to get their degree and graduate. And that might look like success for them. And maybe for somebody else, that isn't their path. But for like somebody like me, that person was able to inspire them towards Islam, or bring them on a pathway that is encouraging them to be more resilient. Sometimes, our issues become somebody else's survival guide in life. And it's a test. All this is a test from Allah subhanahu wa ta'ala, but I've seen it firsthand that people can become successful and they can make a huge difference in their communities. It's more of a struggle.
And is this, is having a mental health condition something that, comes and then, you are able to maybe perhaps treat it, then it goes away? Or is it something that you kind of live with, for the rest of your life? But it's just
So it
something
depends. Yeah, it depends on the severity level
Okay.
of the condition, and it depends on the type of mental health condition as well. So, I mean, if we're talking about anxiety and depression, yes, there are some people I've talked to who've had it for some years, some amount of time. They've completely been able to overcome it. They no longer struggle with it. For most people, it tends to be more of a chronic issue, but maybe they have points in their lives where it's severe, and then they're able to bring it back to more of like a mild concern with medication and with therapy. Of course, with the more significant mental health disorders like schizophrenia, and bipolar disorders and things like that, they're a little tougher to treat. But still, you can, like we talked about, mental health is on the spectrum, and I think everyone, has their better days with these issues. So definitely, it just depends. I would say the more somebody is involved in their treatment and the more they apply the coping strategies they learn, and, there's definitely hope, inshallah, for that being able to happen with Allah's help.
Inshallah. And finally, just before we conclude today's show, what's the biggest piece of advice that you would offer to somebody who is struggling with a mental health condition?
Yeah. I would just say, don't give up on yourself. You matter. The fact that you exist means that you have intrinsic value, that Allah believed you were worthy of being created. So, if you need that sign that someone cares, Allah says it beautifully in the Holy Quran when he says, وَهُوَ مَعَكُمْ أَيْنَمَا كُنْتُمْ. He's with you wherever you are. And that includes him being with you on your darkest days. He's the same one that found the Holy Prophet wandering alone, orphaned, and says, وَوَجَدَكَ ضَلًّا فَهَدَى. We found you lost, wandering in this world. We guided you. So your emotions, your feelings, your hardship, all of that is temporary, but Allah is forever. He's here forever. And so you really have to put your trust in him, that inshallah, you're going to find a way out. You're going to find an opening with your struggles. So if you are struggling, I hope you will reach out, because I don't believe anyone should ever feel like they need to feel like they're drowning on their own with their hardships.
Thank you so much for your beautiful and wise words. And I hope for our viewers who've been listening today that you've been able to benefit from today's show. And thank you so much for watching. And we'll be here again soon, same time next week, inshallah. Thank you. Wa alaikum salam wa rahmatullahi wa barakatuh.